You're the reason why I am my way. You're the reason why I rip my shirts, why I eat at the buffet. Butter, butter, you got your very own kind of nice. We all live inside a butter world. Oh, butter, butter, gonna eat it by the sticks tonight. Gonna eat out this world. Oh, butter, I'm about to take a bite, 'cause I want that salty cream. What I dream about all night. Butter dreaming. I'm about to take a bite, 'cause I want that salty cream. What I dream about all.
What's
going
up,
on?
everyone? We are joined by our wonderful co-hosts, Mr. A and D, and
Yeah. Today I identify as and.
and
You know.
nice, a nice fluid identity, very fitting to today's standards or
Yeah, just be whatever you want to
non-standard.
be. Next day I'll be a stick of butter. My pronouns are buddy, butter, and buttem.
Love it, man. Love it.
Yeah. What's going on, Jay? How's everything over there?
Good, good. Today there was no sun. It was all cloudy, a little bit of rain. It's chilly back here in New England, Massachusetts.
Yeah.
Uh,
It's in
how-
that phase where you get some good days, then it's like, wait, did we even have those good days? And then it's just like crappy
Yes.
again. But it's starting to phase in and out from what I've seen. Over here it's still sunny, it's dry, there hasn't been any rain. We usually, El Salvador usually only sees the wet and dry season, but I did get some sun today, so I'm
Nice.
slightly sunburnt.
A little bit charred.
Yeah, a little bit. Vitamin D boosted,
Nice.
seed oils burned, detoxed from the seed oils, if any, whatever PUFAs I may have had in the
Nice.
system.
Nice.
Yeah.
Awesome. That's
Yeah,
good.
ready.
Charging up with your battery, sunlight battery.
Yeah. Ready to have lots of cholesterol for my skin.
Yes. Definitely good for you.
Yeah. But so what do we got planned today? We have a study club, guys. Welcome
Study
to our
club.
study club. If you're not familiar with study club, this is where Jay and I sit down and we actually dive into scientific studies. We review literature. Today we'll have a short one, very interesting piece. But if you've missed it, go check out our other episodes. We've dived into what gives women heart attacks, right? Those deep dive into what are good risk indicators for heart disease. No surprise, LDL is actually a very poor indicator. Big study, great paper. What else have we looked at? A review article about saturated fats and unsaturated oils, comparing the effects of these in the human body.
Yes.
Yeah, and then we've had lots of science. We dove into
Yeah.
a paper about training with low carb keto diets. Like, do you lose strength? Do you lose muscle? Go check that out.
Yeah.
So this is, these are very technical episodes for the nerds out there, right? This our expectation is to take you along for the journey as we become better at reading the literature and actually having had done the work. Just because your doctor doesn't hold these views about nutrition doesn't mean that the research hasn't been done, right? So
Good point.
that's a little bit about Study Club. What do we got for today's episode, Jay?
So tonight, I want to show it on the screen. We're going to be talking about something that was just published today. It's a case
This was
report.
today.
Yeah, published today, March 28th, by Thomas Seyfried. Case report: resolution of malignant canine mast cell tumor using ketogenic metabolic therapy alone. So Thomas Seyfried, he works at Boston College. So he's a local here from Massachusetts.
Oh man, we
which is
should
pretty
totally
cool.
hit him up.
Yeah, we should probably go to his office, knock on the door, and be like, "Hey, what's up?" But yeah, he's actually pretty outspoken about using the keto diet as a treatment for cancer, or using the ketogenic diet as as a way to reduce cancer growth. He's generally speaking, his point of view is that you can use keto diets to help with this sort of disease. Of course, again, lots of caveats. You can't really boldly claim that keto cures cancer, right? Because if you do that, you get labeled as crazy or whatnot. So right there. So here we're going to cover a paper that he just published, and this is a dog study, um, which is very interesting, right? Caveats again. This is a dog, not a human. So obviously, this is just one piece of information, and it's positive. It's positive.
Yeah, positive finding. But before we get started on that, if you're watching, make sure you like, subscribe, hit the notification bell. Go follow us on, obviously follow us on YouTube, follow us on Instagram, TikTok, Twitter. We're on all these platforms. Buy our merch. We have Make Butter Great Again hats. Lots of Butterfield merch. We have the hoodie that my brother's wearing, and then we have some other fun T-shirts. Make a statement, right? Make a statement, guys. Put politics aside. Food is, it's our sustenance, it's livelihood. And then, of course, if you'd like any assistance with your weight loss journey, we do offer 2-on-1 consultations, individualized coaching to help you get you to the physique of your dreams, sustainably, right? Building muscle, eating lots of meat. We'll find the animal-based diet that is for you. With that out of the way, let's dive into this paper. I'm really curious. I haven't read it yet. I read the headline and the results, but I didn't actually dig into it.
Oh yeah, it can be pretty technical. A lot of technical terms, and again, we're not cancer experts, and a lot of this is kind of advanced terminology. But it doesn't really take away from the message, the core message, which is actually pretty simple. Keto diets can potentially help. So that is a
Yeah.
low carb, high fat diet. All right. So background. Mast cell tumors are commonly neoplasms in dogs that are similar to most malignant cancers, requiring glucose for growth, regardless of histological grade. Ketogenic metabolic therapy, KMT, it will be addressed as KMT in the paper, is emerging as non-toxic nutritional intervention for cancer management in animals and humans alike. We report the case of a 7-year-old pit bull terrier that presented in 2011 with a cutaneous mast cell tumor under the right nostril. And you'll see some pictures up ahead. Cute little dog.
Oh
Yeah.
man.
Yeah. Uh, Methods. The patient's parents refused standard of care and steroid medication after initial tumor diagnosis due to the unacceptable adverse effects of these treatments. Following the tumor diagnosis, the patient's diet was switched from all-raw dog food to raw vegetables with cooked fish. The tumor continued to grow on this diet until July 2013, when the diet was switched to a carbohydrate-free, raw calorie-restricted ketogenic diet consisting mostly of chicken and oils. A dog food calculator was used to reduce calories to 60%, 40% calorie restriction of that consumed of the original diet. A total of 444 kilocalories were given twice a day, 12-hour intervals, with one medium-sized raw radish given as treat between each meal.
Oh, that poor dog, man.
Yeah,
Raw radish is a treat.
yeah, raw radish as a treat. But pretty interesting that they switched to raw vegetables and cooked fish, and the tumor continued to grow. And then they switched to a carbohydrate-free, raw calorie restricted ketogenic diet, chicken and oils. You'll see the menu further ahead. Um,
Hmm.
Also, kind of important to highlight, they were measured on their food, right? I guess it's kind of easy to control how much food your dog eats because you're the one feeding your dog. So
Yeah.
you can see the advantage of using this on an animal. If you were a human, can you imagine like restricting 40% of the calories of a human every day? It'd be tougher.
Yeah. Wait, does it say how long it was for? Uh,
Um,
Does it
it,
really
it-
matter?
not here, but it does mention it further ahead.
Okay, okay.
The results: the tumor grew 3 to 4 centimeters and invaded surrounding tissues while a patient was on the raw vegetable and cooked fish diet. The tumor gradually disappeared over a period of several months when the patient was switched to the carbohydrate-free, calorie-restricted ketogenic diet. The patient lost 2.5 kilos during the course of the calorie restriction and maintained an attentive and active behavior. Right. So basically saying even though calorie restriction what happened, the dog was still, attentive and active. The patient passed away without pain on June 4th, age 15, from failure to thrive on an enlarged heart with no evidence of mast cell tumor recurrence.
Oh, rest in
Yeah,
peace.
yeah, RIP. But uh, 15 years further ahead in the paper, you'll see that that's like the full life expectancy of a dog, basically.
Yeah, yeah, makes sense.
Yeah, yeah. Conclusion: this is the first report of a malignant cutaneous mast cell tumor in a dog treated with KMT alone, the keto diet. The resolution of the tumor in this canine patient could have been due to the diet-induced energy stress and the restriction of glucose-driven aerobic fermentation that is essential for the growth of most malignant tumors. Further studies are needed to determine if this non-toxic dietary therapeutic strategy could be effective in managing other canine patients with malignant mast cell tumors.
Yeah,
Nice.
as you said, very promising finding. I will say, in the keto community, if you've been around for a while, you've certainly heard of like keto and fasting being, recommended for people with tumors. Uh,
Oh, are we losing you, Mr. Anderson? The Wi-Fi lords, the internet lords, don't want you communicating this to the public, to the general world out there. Jason says a raw radish treat. LOL. I know, right? It's quite the treat, you would say. Mr. Anderson will. It looks like he's trying to log back in, but no worries, no worries. I see he's logging in back here, but I guess we can continue and he'll hop on. I'll continue with the introduction. Canine cutaneous mast cell tumor, MCT, is a common malignant cancer in a range of dog breeds. Emerging evidence indicates the cancer is a mitochondrial metabolic disease. So basically saying cancer happens because your mitochondria stops working. Uh, Aerobic glucose fermentation, the Warburg effect, linked to defective oxidative phosphorylation, OXPHOS, has been documented in canine MCT, as it has been in the majority of human cancers, regardless of histological or genetic heterogeneity. Unlike normal cells, cancer cells can grow in the absence of oxygen using glucose and glutamine as fermentable fuels. Uh, yeah, yeah, pretty straightforward sentence. Cancer cells grow because they're using glucose and glutamine. Glutamine is an amino acid, which is actually pretty abundant. Hey, welcome back, Mr. Anderson. Hopefully you're here to stay this time.
hey, what's going on, Jay? Can you hear me?
Yeah, I can hear you. I hope you can hear us or hear me. This is just.
Hey, can you hear me?
Yeah, I can hear you, but
Oh, bro, I can't hear you. Why?
it seems like you don't hear me. Yeah. Um,
Oh, shit.
yeah, man. The bottom. Did you just change your name to Bottom? Okay, we lost him. Ketogenic metabolic therapy, KMT, is a non-toxic therapeutic strategy for cancer management that restricts the availability of fermentable fuels while elevating levels of non-fermentable fatty acids and ketone bodies. So basically saying the keto diet is a diet that reduces the amount of glucose available, right, because you're using ketones, and also reduces the amount of glutamine, which is that amino acid, that the cancer cells can use as fuel, because you're basically feeding yourself on non-fermentable fatty acids and ketone bodies. Fat as a fuel, ketone bodies as a fuel, triglycerides as fuel. Metabolism of ketone bodies in normal cells increase the redox span between mitochondrial complexes 1 and 3, thus increasing the delta G and ATP hydrolysis, while at the same time reducing the formation of reactive oxygen species, ROS, through complex 2 coenzyme Q couple. All right, so that was way too advanced. Way too advanced. I just know reactive oxygen species, that if you have a greater number of reactive oxygen species than antioxidants, it tends to be a pro-inflammatory state. So you want to have more antioxidants to offset the amount of active ROS, reactive oxygen species. But Mr. Anderson, I can see you and I can hear you, but can you hear me?
No, I can now. I can now. I
Okay.
couldn't before. I don't know what was going on. My apologies.
Oh, no worries, man. It's the overlords that don't want us to communicate this message.
Yeah. So they're being they're discriminating against me and my pronouns. Right now,
Oh yeah.
I'm feeling like butt.
You had to adopt a third identity. No longer Anderson or A and D or bottom. It's now
Yeah.
butt.
My butt is my butt feelings are hurt. But anyhow, let's get back to it.
Anyhow, so yeah, I'm just finishing up this introduction over here. Kind of quick recap, basically saying that the keto diet provides it's a non-toxic therapeutic therapy strategy because it restricts glucose and glutamine, which seems to be the fuel sources for cancer cells. So that's like the working hypothesis, the working theory. And according to the introduction, there's apparently some evidence to support these mechanisms. It is for these reasons that ketone bodies are considered good medicine for enhancing mitochondrial energy efficiency and general physiological health. We therefore propose that KMT might be helpful in managing canine MCT. Right? So obviously this paper is going to be very specific about canines. If it suddenly starts claiming this on humans, that's it's going to get ignored and completely disregarded amongst the medical community. Calorie reduction and calorie restricted diets can also target multiple hallmarks of cancer, including angiogenesis, inflammation, edema, and tumor cell viability. In contrast to cells with normal mitochondrial OX-phos capacity, cancer cells lack the metabolic flexibility and cannot efficiently use fatty acids, ketone bodies, or other respiratory fuels for ATP synthesis. The well-documented abnormalities in mitochondrial number, structure, and function compromise energy synthesis through OX-phos. KMT, used either alone or in combination with standard of care, has therapeutic benefit for managing a broad range of animal and human cancers. In this report, we present evidence showing that KMT alone was able to resolve malignant cutaneous MCT in a dog. So you can find a lot of Thomas Seyfried. If you search his name on YouTube, he actually does a lot of lectures and talks about this, basically saying that there's actually some people who use the keto diet along with chemotherapy and see a recovery. He talks a lot about this, or some people trying to use keto diet by itself, but sometimes that not being enough, sometimes being enough. It's kind of all over the place, but it seems to be a good thing to use with, with other treatments.
Yeah, absolutely. And some people, I like that this paper mentions that cancer cells can't really are not metabolically flexible. Some people will debate that, say that it depends on the type of cancer, but I think generally across the board, like most cancer, like relies on glucose. We'd have to just put in that warning out there. I guess we'd have to dive into how true that is. But yeah, before I got cut off, I was gonna say I remember Dr. Eric Berg shared a story from a guy who had stage 3 colorectal cancer, and he effectively completely, I think he did one chemotherapy session before he kind of just like didn't want to do anymore. He did basically a carnivore or keto diet and lots of fasting, and then the tumor was pretty much gone.
Yeah.
So
Yeah, you posted it on Butterfield, right? It's like one of the posts is probably a few months back, probably half a year back in terms of posts.
yeah.
Right.
I forget the name of the guy, but he wrote a book about it. Really, really crazy story. But the human body wants to heal, and
Yes.
doctors hate to hear that, I guess.
I mean, that's true. That's true. That's actually, yeah, we should take a moment and realize that at the end of the day, the best we can do is just provide treatment for the symptoms and kind of just let the body heal. Doesn't matter the disease. It's just you're just trying to help the body heal, but the body's gonna heal itself in the end. Um,
Exactly.
so yeah, yep. Do you want to take us through the case report, Mr.
Yeah, yeah,
Anderson?
yeah. So it's a pit bull. We gotta change the thumbname picture. uh, 7 years old, 60-pound female pit bull presented on July 28, 2011 at the Banfield Pet Hospital, Conyers, Georgia, USA, with a cutaneous mass under the right nostril. Microscopic analysis of the tissue smears revealed high cellularity with loose sheets of round to oval cells. The cells had indistinct borders, and the cytoplasm contained large numbers of prominent metachromatic cytoplasmic granules. The nuclei varied mildly to moderately in size, and the nucleoli were rarely visible. Eosinophils were scattered frequently throughout the smear preparations. Cutaneous mass was diagnosed as mast cell tumor, but was not graded at that time. Based on clinical behavior, this tumor was likely a progressive low-grade neoplasm at the time of diagnosis. A complete blood work analysis revealed no deviations from normal ranges at the time of the initial diagnosis. Okay, so I guess it's pretty early stage tumor.
Yeah, yeah, and yeah, very technical terms about trying to describe this tumor itself.
Yeah,
But we'll see some pictures for here. You'll see soon.
right. Yeah, should I go on? Although
Yeah.
steroid medication, prednisone, and standard of care, including surgery, chemotherapy, and radiation therapy, were discussed as therapeutic options, the patient's parent refused any of these treatments due to their unacceptable adverse effects. Significant adverse effects have been reported in dog with cutaneous MCT treated with SOC, standard of care.
Mhm.
2 weeks after tumor diagnosis, the patient's diet was switched from all roy canned dog food to a raw vegetable diet with cooked fish and lentils. The tumor continued to grow on this diet, invading local tissues and reaching a size of about 4 centimeters. Local invasion is a hallmark of malignancy and the first step of the metastatic cascade. 2 weeks prior to the July 2013 image shown in Figure 1A, the patient's diet was switched to a calorie-restricted raw ketogenic diet. A full image of the patient's face is shown in the supplementary material. As no further diagnostic analysis was done on the tumor in 2013, it is not known if the gradient of the tumor would have increased over the 2-year period from the initial diagnosis in 2011 to that shown in Figure 1A and in the supplementary material. The decision to switch the diet from raw vegetables to raw calorie-restricted ketogenic diet was based on the view that dogs evolved from wolves, which are largely carnivores, and on the general information presented in the following YouTube video using the following dog food calculator. The patient's parent estimated that a 60-pound light-duty working dog should consume about 1,500 calories per day. Consequently, a 40% restriction of this value was used to estimate a daily caloric intake for this patient of about 900 calories per day. The new diet was formulated to contain the following ingredients. Oh my God, so the 60-pound dog is estimated to be ingesting about 1,500 calories per day. Man, I know. We've met in our clients or client calls. We've had people who are like 120 pounds and they're eating like 1,200 calories, man.
12.
And
Yes.
and the 60-pound dog is eating more than these people. Clearly they were under eating. We never recommended that, of course, but that
Yeah.
60-pound dog eating recommended to eat 1,500 calories. I mean, uh, you know,
I know, right? It's pretty telling. Just 60 pounds, 100, 1,500, but it was
yeah,
60 pounds then reduced to 900, and that seems, I guess, more more reasonable, but still 60 pounds, 900 calories. It's crazy. So let me show the pictures here quickly. Let's see if we can get it to load. So it's the other.
Oh,
Yeah, maybe. There we go.
poor puppy.
Yeah, here you can see July 2013 and then October 2016, like new.
Yeah. Wow.
Yeah, it's pretty visible, very, very visible.
Yeah, it's strange that they were given the canned food, then they gave raw vegetables, and then they were like, "Wait, well, hold on a minute. Dogs come from wolves. Shouldn't he be eating raw meat?" They're like, "Oh my God, of course, duh."
uh,
It's funny,
yeah,
funny progression of events.
yeah. I mean, once you suddenly like, I don't know what happens, right? But so you're living your normal life day to day. You follow the basic recommendations, and suddenly an alarm hits you, and you're like, I have to wake up. I have to change something, or this is not going to work out. Um, so that's why you kind of see like people kind of jumping the diet.
Yeah, I wonder if the parents suddenly realized, like, hold on a minute. So if they came from wolves, dogs are man's best friend, then maybe we should be eating meat too. And then they just went like full carnivore, and then they're like, oh my God, this was a big red pill for them, for the dog's parents.
Yeah, and yeah, bless them for making that realization, because honestly, like we were all there, right? Because it's that we say this, there's belief given to you, and there's this truth that you find out for yourself, right? So obviously, belief given to you, you just, hey, this is, I buy dog food from the grocery store, from a dog food aisle. I give that to my dog. That's the belief I'm giving, and that's what I do every day, day in, day out, until you're forced in a situation to find out the truth for yourself and start actually making like logical thoughts on yourself. Wolves, dogs, carnivores. Why don't we give this dog chicken? Pretty simple. Um, and it works.
It works.
It works.
Yeah. So what did they feed? They say one organic raw chicken leg with bone, one organic raw chicken egg, 1 tablespoon of pure Lauana coconut oil, and 3 teaspoons of grizzly pollock oil for dogs.
Fish oil. Yeah. Yeah. Very interesting. But yeah, basically fat and protein, fat and protein.
Nice, yeah. And then they were fed this meal twice a day because they're saying this carbohydrate-free dietary formulation, completely carb-free, produced 444 calories per meal with a fat-protein ketogenic ratio of about 1.3 to 1, and was fed to a patient twice a day in the morning and in the evening at 12-hour intervals. There were no issues of compliance as the patient enjoyed treats. One medium-sized raw radish, 0 protein and 0 fat, was given between each meal. Yeah, sure. Like that's what kept the dog going. The raw radish. The
Yes.
tumor gradually disappeared over a period of several months when the patient was switched to raw, calorie-restricted ketogenic diet. Ketogenic diet. An image of the patient's face taken in 2016 is shown. We looked at that. Patient lost 2.5 kilograms during the course of calorie restriction and maintained an attentive and active behavior, according to the parent. The patient was fed this calorie-restricted ketogenic diet until 2019, once the tumor was no longer apparent. The patient was occasionally given cooked chicken as an alternative to raw chicken, and the patient passed away at the upper age of longevity for his breed, 15 years, in the arms of the parent without pain on June 4, 2019, from failure to thrive due to an enlarged heart. No evidence of mast cell tumor recurrence was observed on the nose or anywhere else on the patient's body. It is known that overall survival for grade 2 MCT is about 21 and a half months, and for grade 3 MCT is only about 9.2 months. This patient survived 63 months, living a normal lifespan after resolution of the cancer. Wow, how great is that? How
Yeah.
great is that? Ketogenic diet and calorie restriction, the powerful combo for longevity. Don't be fat. Don't be like overweight or obese. Try to lose the excess weight, and obviously eat real food. And the only issue I have with what they were feeding the dog is it was chicken, and then it was coconut oil, and then the grizzly pollock oil, which I don't know what that is, but
Fish. Yeah. Some.
you
Yeah.
know
Some. Yeah. Fish.
only they were feeding the dog like some red meat. Man, might have lived till 20 after.
Yes. Yeah. 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 So here's a nice timeline. Canned food, right? This tells you people were just following what they were told, believing the beliefs that they were told. Uh, Suddenly they try to change something over here. Raw vegetables, right? Because vegetables are nutrient dense and nutrients are in vegetables. That's healthy. Didn't work. Then the keto diet, basically, plus calorie restriction. I think that is also important to mention. Calorie restriction, significant tumor reduction, sustained reduction, um, so on and so forth.
Yeah, it took 2 years for them to switch to the keto diet.
Yeah. Yeah, that's pretty wild. Okay. So I'm just trying to zoom back in properly. There we go. A little bit more.
Yeah, that's good.
All right. So just we're nearing towards the end. Discussion. I'll read the first paragraph and then you can take over. This is the first report to our knowledge of malignant cutaneous MCT in a dog treated with KMT alone. It is clear that from our observations that KMT protocol used for our patients did not cause any adverse effects. No adverse effects or safety concerns were reported previously in canines treated with KD, keto diet, for managing epilepsy. Cites a couple studies there. The diet-linked resolution of the tumor in this canine patient could have been due in part to the restriction of glucose and to the inhibition of aerobic fermentation, the Warburg effect. That is essential for the growth of most malignant tumors. So glucose and glutamine. A limitation of our report, however, is the absence of data collected on blood glucose, blood ketone bodies, and blood ketone index values in a manner similar to those collected previously in our case report of a human brain tumor patient. So it sounds like Thomas Seyfried, I think he has mentioned this in his talks about having case studies with humans and tumors. So we can look into that some other day.
Wow, yeah, that would be pretty big.
Yeah. Yes. We'll take it away, Mr. Anderson.
Yeah. It is recognized that the genome of most cancer cells, including those in MCT, contain numerous types of pathological somatic mutations. Abnormalities in mitochondrial DNA and biochemistry have also been reported previously in canine cutaneous MCT. These genetic abnormalities will prevent metabolic flexibility and adaptability to nutritional stress. Adaptability to abrupt environmental change is a property of the normal genome, which was selected for in order to ensure survival under environmental stress. According to established evolutionary concepts, only cells possessing flexibility in nutrient utilization will be able to survive under nutrient stress. Environmental forcing over eons has selected for genomes that are capable of adapting to abrupt change in order to maintain metabolic homeostasis. Previous studies showed that normal dogs are remarkably adaptable to food restriction and physiological stress. The genomic defects that occur in MCT, together with mitochondrial dysfunction, will prevent the metabolic flexibility needed for rapid adaptation to nutrient stress, thus leading to tumor cell elimination through a combination of autophagy and autolytic cannibalism. The metabolically flexible normal canine cells will outcompete the mutated inflexible MCT cells for the availability of restricted nutrients, thus leading to the elimination of the tumor cells. It is therefore tempting to speculate that in contrast to the normal body cells, the neoplastic cells in the patient's MCT were unable to adapt to the nutritional stress produced from the carbohydrate-free, calorie-restricted ketogenic diet, thus causing rapid tumor resolution.
Yeah. So yeah, like yeah, I think you mentioned this before. Like yeah, the cancer cells can only aren't they're not really healthy cells, so they don't have the capacity to use other fuels. They're pretty simple cells, just using glucose, using glutamine, easy to burn, whatever. But so they don't have the flexibility to burn ketone bodies, um, thereby kind of just starving themselves and dying off.
Yeah, exactly. Just following the principle of autophagy, and they also mentioned autolytic cannibalism, which it's like, I guess it's just fancier words for saying the same thing. Like your cells are consuming themselves, and your the like the proteins and the fats in your tissues are being recycled by your body, um, kind of having to like trim away the fat that's not needed, resulting in the tumor cells being killed, which is amazing.
Yeah. Yes. Yes. And then last but not least, calorie restriction and restricted ketogenic diets have had success in reducing growth and metastasis in a range of malignant tumors in mice and humans. Cites several studies here. In none of these cases, however, was resolution of tumor achieved with diet alone. So keto diet by itself was not enough. Although a human glioblastoma patient has remained alive for over 8 years using KMT alone, no steroids, no radiation, no chemotherapy, which I believe these are your standard of care procedures, the tumor in this patient was not resolved but continues to grow slowly, requiring periodic debulking for continued management. Synergy between restricted KD and glutamine targeting drugs could also facilitate resolution of more aggressive tumors, especially for those involved in the systemic metastases and growth in the nervous system. The resolution of the MCT in this canine patient should be viewed as anecdotal until further studies are conducted in other canine patients using a therapeutic strategy that is the same or similar to that used in our canine patient.
So hold off until we have about we have a study that takes 1,000 dogs with a tumor. Then we put them all in, we put a group in canned food diet. We put the other ones in a vegan diet. We'll put the third group in the keto diet, and then I don't know, you need a control group, but I guess that's just like the normal canned food. And then that'd be a very interesting study, actually. You can you probably upset some ethical boards, though, because it's animals, so it's dogs. But it's probably the best we could have. Still very hard to do, but
Yeah, yeah, yeah.
anyways, yeah, I was just rambling, but pretty impressive stuff. The dog went ahead and lived a full life.
Yeah, yeah. Upper limits of its life expectancy of its breed, 15 years. Um, and yeah, obviously, in this sort of papers, you gotta kind of nip it over here with a caveat saying, oh yeah, just that this is an anecdote, this is just one, but we need more research. That's how you like neatly put it, so you don't get labeled as crazy or unscientific or whatever. Nonetheless, this is a
Yeah,
positive data point. Uh,
absolutely. I mean, I think, like, I obviously, like, I mean, if the very unfortunate situation would come up where like I were diagnosed anything similar, I'd probably just go in like a 40-day fast, or something like that.
yeah,
Like, uh, you know, there's I remember watching a documentary about fasting once, and they showed that there was this like clinic in, maybe it was Germany or Russia, um, where they were treating cancer patients with like fasting. That give people that that be at the clinic just not eating, I guess. But it certainly seemed to be effective. But oh, I see you're looking at Thomas Seyfried.
yeah,
You have to make some clips about this guy. It seems like he's got some interesting stuff to say.
yeah, yeah, yeah. More, yeah, that's true. More people need to know about this, right? Because people either get scared about keto, get scared about carnivore, get scared about low carb. It's somehow killing you, but somehow, seems to be beneficial for human health, right?
Yeah.
So if you
It's a
want
stress state. It's a fasting mimicking state. Oh.
to oh man, and you do also bring up a good point, because if people start talking about keto and cancer, uh, you like you said this, some super smart people will say, oh, here's a smart response: some cancers use ketone bodies too. And like, okay, so that completely diminishes or dismisses whatever positive evidence that we have here, right? Okay, so I mean, who are you trying to help when you come up with like, smart ass arguments like that? There are
Yeah.
some cancers that use ketone bodies. Okay,
Yeah. You know.
cool.
Yeah. I don't know which ones, but
I don't
it's
know.
going to be interesting to look at the opposing view. See if it's even
Yeah,
worth any
a grain
any.
of salt.
Yeah. Yeah. Exactly. But in the meantime, hopefully in the next 20, 30 years, maybe we'll get some good studies, and maybe then in 40 years we'll have, health experts and the medical curriculum changing. But until then, unless you find a doctor who's on the same wavelength, on the same level of consciousness,
Mm,
it seems like most people are gonna be left on their own to kind of like figure out this stuff and then try it for themselves. Um, like
yeah.
think about like those parents, right? The dog's parents. For 2 years, it took 2 years. Maybe they those 2 years, they were probably like trying to learn about how to get rid of tumors, and then they came across the conclusion that, wait, hold on a minute, dogs come from wolves. Wolves are like strictly carnivorous, so maybe we should be feeding the dog a species appropriate diet. And I hope that the parents themselves were enlightened that the same applies for humans. They should really stop eating human canned food, or eat human boxed food, for that matter. uh,
Yes.
you
Yeah.
know, zero carb. The dog was fed zero carbs.
Yeah. Basically, yes. There was a radish there, but
Went
it's
from raw
such.
vegetables to zero carbs.
Yeah. Yeah. Um, yeah. No, that's a good point. It took 2 years, right? They started trying to, they had the dog. How long did they had the dog for? I remember at the beginning of the paper, they had the dog since like pretty much baby age. Um, so the dog was born 2004. Did we lose you, Mr. Anderson? I think we lost Mr. Anderson. Once again, we lost Mr. Anderson. But yeah, basically, the dog was born 2004. From 2004 to 2011, you know, getting fed canned food, which is kind of surprising that the dog was able to live this long, and then develop a tumor after that. But yeah, life hits you with the truth, and you have to quickly start searching for it, um, or else, right? Mr. Anderson,
Yeah, I'm back.
welcome back.
Man, we're really making some people upset with this episode. They don't want you to know the human body can heal itself.
Yeah, that's true. That's true, right? That's also like sort of like hidden knowledge that we sort of know, somewhat don't know, right? If you get sick, you still feel like you need some medication. Um, so yes, you can treat the symptoms, but the disease will treat itself by the body.
Yeah.
But yeah, I was just highlighting that the dog was born in 2004, and then fed the canned food for 7 years of its existence, and then 2 more years, or yeah, from July to August. It wasn't until August it changed to the vegetables and fish, and then 2 years from there, that vegetables and fish with no tumor improvement, regression. Zero carbs, man, zero carbs. Does that mean we humans should follow a zero carb diet? I mean, we're more resilient, so we can probably get away with it more, right? Our margin of error is pretty big, right? So we can mess up a lot and still make it through.
Yeah.
So yeah.
But yeah, we should wrap it up.
45 minutes.
a
We
good-
wanted to do 20 minutes.
Yeah. So it's a good place to end, So, great study, another great study club. We'll definitely have to dive deeper into some of Thomas Seyfried's work. So, if you're watching this, thanks for watching. Wish you a great night. Don't forget to like the video.
Thank you, everyone. Really appreciate it. Wishing everyone a happy, healthy, and higher nutrient dense lifetime. Have a good night.
Fantastic. Peace. Good night.
Butter! Gonna eat it